1, 2, 3, 4. Wait. 1, 2, 3, 4. No, wait. 1, 2, 3.
Ma'am, you have counted it 7 times already. Give it to me.
No, wait. 1, 2, 3.
Ma'am, there are customers behind you.
Just a moment, please. I have to count it 10 times.
Why?
You won't understand. If I don't, all the things I buy will become worthless. 1, 2, 3.
You are crazy.
It sounds odd, but you don't understand. No one does, but I have to do it.
To some, it's stupid. For others, such people waste their time. And some might even justify behaviors such as these as precaution. But people who engage in such patterns sure don't feel very happy about them. Why? Let's dig through the word of obsessions and compulsions and figure out वहम और उसका इलाज. Hi, I'm Dr. Jyoti Kapoor and we are at Manasthili, where mind meets matter, addressing some of the significant issues related to Obsessive Compulsive Disorder or OCD. We often come across people who we call cleanliness freaks or stickler for orderliness. Some even pride themselves for being obsessive about certain things like clothes or shoes or work in a certain specific way. While most of these people don't fall in the clinical category of OCD, some do find themselves struggling with their routines due to their inability to control their thoughts or repetitive compulsive behaviors. It's then that one starts searching if something is wrong with their wanting to stay squeaky clean or get fear and anxiety at the thought of touching anything or even repeating a mental or physical activity over and over again because they feel scared of something going wrong. OCD is a psychiatric condition associated with anxiety and affects 1 to 2% people worldwide. In clinical practice, OCD is seen both in children as young as 6-year-olds and older adults in their 90s, doing things repeatedly. It can be quite annoying for the people in their environment, and most of the time the patient is blamed for not being able to stop himself or herself. Often parents use statements like, इतनी बार समझाते हैं पर फिर भी हाथ धोता रहता है, एक साबुन एक दिन में ख़त्म कर देता है और हाथों को तो देखो इसके. And at other times I hear 3 घंटे नहाती रहती है, दूसरे लोग परेशान हो जाते हैं. Because the person otherwise does not grow horns, the symptoms are considered to be deliberate, and some go to the extent of saying that patient enjoys harassing the family. So, let's understand what OCD exactly is. The term OCD has 2 components. One, obsessions, and the second, compulsions. Obsessions. These are repeated, persistent and unwanted thoughts, urges or images that are intrusive and cause distress or anxiety. Obsessions often have themes to them. For example, fear of contamination or dirt, doubting and having difficulty tolerating uncertainty, needing things orderly and in symmetrical order, aggressive or horrific thoughts about losing control and harming oneself or others, unwanted thoughts including aggression or sexual or religious subjects. The second component is compulsions. The doubt or fear caused by obsession makes the individual repeat certain behaviors which help lessen the anxiety. So, compulsions are defined as repetitive behaviors or mental acts that one feels driven to perform because it provides temporary relief of anxiety. These compulsions often take form of rituals or rules like washing and cleaning, checking, counting, orderliness, following a strict routine, or demanding reassurance. OCD, like other psychiatric conditions, requires presence of certain set of diagnostic criteria listed in ICD-10 or DSM-5. And a qualified mental health practitioner, usually a psychiatrist, can identify the symptoms and severity of the condition. It's not always easy to differentiate OCD from certain other disordered thought processes like preoccupations or delusions, and therefore, Checking on internet may not be sufficient and would definitely not help in management. I have recently seen a patient being treated for psychosis because he was afraid to leave the house when he actually had obsessions. OCD is one of the most debilitating psychiatric disorders and causes more suffering to the patient because he blames himself for her involuntary thoughts or compulsive actions. Patients often hide their symptoms due to the fear of being called crazy. Children and adolescents are unable to understand their own thoughts and start justifying them, thereby becoming defensive and stubborn. Family members and friends become wary of patients' behavioral excesses and sometimes even encourage them to perform compulsions to keep them calm and functional. There is evidence that it's a heritable condition and family members may have similar symptoms or personality traits which are less intense and don't hamper much in day-to-day life, making it even more difficult for the patient to seek help. Patient often might say that it's normal for my mother, so it should be normal for me as well. The course of disorder is often fluctuating. Periods of stress cause increase in obsessive ideas, and periods of relaxation may reduce the symptoms. Some have better control on compulsions outside of their comfort zone. One of the reasons why many caregivers think that it is deliberate. Untreated OCD tends to progress, and compulsions, being the only coping learned, becomes resistant to treatment. I have seen patients who have spent their lives avoiding people and places outside their houses, did not build careers, family, or social life, and consequently developed several health issues. But when told that they can get better with proper treatment, end up repeating the same rhetoric that psychiatric treatment has side effects. What side effects are greater than spending all of one's life alone in a sterile space? And then there is bunk.
I just need my nails to be perfect. It's my OCD. I need a manicure every 15 days.
I know. Same is the case with my dresses. They have to be the perfect cut. I can't wear anything less. My boyfriend says you are so obsessed. But that's the way I am, and I'm not getting rid of it.
Being particular about certain things, be it one's looks or what they eat or wear, is a common occurrence. We often have some rituals, a particular pen we consider lucky, but those are not obsessions. Comparing superstitions or cultural beliefs to OCD is trivializing the issue and spreads confusion about diagnosis and treatment. Recently, the COVID pandemic made it very difficult for people to understand what they should or shouldn't do when it came to keeping themselves infection-free. Over the last 2 to 3 years, incidence of anxiety has increased manifold, and some of the cases are typical obsessive compulsive disorder. Another strange happening is justifications given by people for OCD. Clinical condition of OCD is a neurotic condition where the cautious behavior is exaggerated and illogical, causing great functional disability. People with underlying anxiety and obsessive personality traits have developed typical OCD which did not subside and has needed psychiatric intervention. Having touched upon the basic understanding of OCD and before moving forward to understanding treatment options, let me touch upon a few points here. Obsessions and compulsions don't always occur together. Sometimes they are only involuntary thoughts. At other times, thoughts are justified to such an extent that patients don't consider them as problematic at all and go to great lengths to preserve their rituals, even though it may be hampering them in their routine life. Obsessions are sometimes also seen in other psychiatric conditions as well, like schizophrenia, bipolar disorder, borderline personality disorder, etc. Obsessions are also associated with anxiety, depression, and alcohol or drug use. Certain obsessive impulsive conditions appear more like addictions. The management is thus very individual-centric and not an algorithm in the textbook. In our next episode, we will go over the treatment options and management strategies with the caveat that information is not same as knowledge. So always seek expert advice for correct diagnosis and treatment. And if you like our show, then please like, share, and subscribe to our YouTube channel. Manasthali, where mind meets matter. See you soon.